Dr. Young, could you please introduce yourself?
Sure. So I'm Dr. Larry Young. I am a child, adolescent, and adult psychiatrist in Minneapolis, Minnesota. I have a private practice right now. Before this, I worked many years in the community at different outpatient clinics, inpatient units, partial hospitalization programs, et cetera. As a part-time gig, I'm a psychiatrist for a number of professional sports teams in the area. I'm the team psychiatrist for the Minnesota Vikings, and I work with players also on the Minnesota Twins, Minnesota Lynx, Minnesota Wild, Minnesota United soccer teams, working with the athletes on a number of different issues and hoping to lend some help to this project today and get the word out to different athletes that you're working with. Thanks for having me.
Thank you. Dr. Goring?
Hi, my name is Paul Gehring. I'm a psychiatrist. I spent my formal career as both a practitioner and a physician executive at Althing Health. But in this post-career time, I'm focusing on community health and areas where we know communities can be healthier with uh, wise interventions. And one of them is around physical activity and uh, having physical activity be part of the reason you thrive. And my time today is really thinking about how we can do that better, both aspiring professional athletes and athletes that are more like me who just put on their shoes and go do things for fun.
Super. And I am the CEO and founder of Althing Health and Althing Clinic, Matt Johnson. And we provide the air service to school districts, colleges, and athletes. What we've noticed across school districts and working with young college students is a lot of suffering in silence. There are a lot of people who have real mental health concerns that are just quietly going about their day. And maybe they're having ups and downs, but they're not connecting to the help that they need, or they're not doing the proper self care. It goes from small things like not getting enough sleep and being tired to really big things like running yourself down. Ultimately, we've seen suicide become a real factor, even among athletes. How do you recognize in yourself or even in a player on a team that they may need that help? Is there a way to know?
Yeah, I think, a lot of times I'll work with high school kids or younger where the referral source is their parent or their coach, someone who says, hey, I think you ought to talk to somebody about this. They're noticing something, whether it's a change from baseline. Okay, well, he usually comes to practice ready to go. He's smiling, he's talking to his friends. Now he's looking at the ground, he's not paying attention, or I saw him in the locker room crying after a game, or there's changes that coaches might notice, parents might notice. A lot of times they'll bring that kid to attention. A lot of times it's the person who's struggling themselves who either goes to a coach or a parent, or in a professional athlete situation, maybe an agent, and says, I don't know what's going on. I am not enjoying this anymore. I don't want to do this anymore, and I don't know why. I've wanted this my whole life. Why am I not wanting to do this right now? So a lot of times that's kind of how they come to me. That's how they come to my office, or how I meet with them. Um, but it's tricky. There's a lot of repercussions, and the further up you kind of go in sports, especially, the more of those repercussions you're worried about. So they're very actually reluctant, I think, to speak up a lot of times about these issues. And unfortunately, again, to use the analogy that Paul gave, a lot of times they wait till the pain is too severe for them to ignore anymore.
I think what I add to what Dr. Young just said is if you think about stigma, what we're talking about is behaving differently about our emotional health than we do about other things. What's the reaction you get when you hear a friend's got cancer? It's like, oh my God, what can I do? Or if you're worried you have cancer, doc, what can I do? Think about how different that is from emotional symptoms. Personally, we're reluctant, as Larry said, to sort of express them. What would the impacts be? And people are less enthusiastic about reaching out and saying, "Hey, what can I do for you?" And I think if we just remember, this is no different than having a health condition, whether it's cancer or heart disease or diabetes or orthopedic problem. Athletes now are seeing Michael Phelps and Simone Biles and all just said, I've got this thing and I'm a great player and I'm going to stay great because I'm going to take care of myself. And and we haven't seen it really interfering with careers. And I think the same is true for coaches and family members. I see this. I want to help. I can help you find help. And I think just to think about, don't let the stigma, don't behave differently than you would for any other physical condition. And if you do, ask yourself that question: what's getting in my way for reaching out and helping this person who I like playing this game with, or I like seeing play the game, or I love seeing them when they're at their top of their game. So I think that stigma is the part where we can control it, both as taking care of ourselves and how we help others.
Yeah, Carl Anthony Towns on the Minnesota Timberwolves. He's
Yeah.
talked a lot about his struggles. In fact, there's a woman who works for the Vikings. Her name is Lindsay Young, no relation, and she has a whole series of articles over the last few years where these Minnesota Vikings football players kind of came out and talked about either their own personal struggle with mental health issues or their family struggle or something that they experienced, that they're facing down this stigma, and they're basically saying, I don't care, this is life, and people need to know this, and I'm going to tell you my story. And they're very brave to do so, but there are a lot more athletes kind of coming forward and telling their stories. Kevin Love, who used to be on the Timberwolves now, he's used to talk about panic attacks he would get on a regular basis. So yeah, it's great to see people coming out and being more open about it. It does encourage younger generations to do the same.
I think one of the challenges in sports is that you learn how to play hurt and go do your game. And I think the consequence of trying to suppress a mental health challenge might be more concerning than suppressing a physical difficulty. But you're a 14-year-old soccer player or hockey player, and your parents are really wanting you to focus on this. Your coach is pressing you to do this. It might be a different world to be able to come out and say something. You might have different access levels. You might not know how to take that first step, and maybe that step might have to come from the coaches and the parents to have them involved in a proactive health service or to talk about it. How do you bring that up? How do you bring it up most effectively, and sometimes without betraying the trust of the athlete by bringing it to their parents? Or is there, how would you navigate that as a coach?
So not letting it sort of fester. To give you an example, not from my life as a psychiatrist, but my life as a youth baseball coach. Both my sons played youth baseball for a long time, and one year we had a young man on my younger son's team who was a really amazing athlete, but he struggled with anxiety, and one season he got what we refer to as the yips, where he just got more and more anxious, and he got to the point where he couldn't throw a ball within 10 feet of his target. They tried to put him at catcher, and he couldn't even throw the ball back to the pitcher. He would have to roll it. I mean, it was really getting bad. And some of the other coaches I worked with, to their credit, they would say, "What can we do here? What can we do?" One coach would say, the head coach was great. He'd say, "Okay, well, let's get him involved in smaller activities and try to help him work through it." And of course, as as a child adolescent psychiatrist, I had to ask the obvious question: Can I talk to the kid about what's going on the field and try to talk to him about his anxiety? And afterwards, he said that really helped. All those interventions helped, but he was very open to talking about what happens and where the anxiety comes from and how it affects his ability to even throw this ball back to the pitcher. So, I think these things don't just go away. You have to shine a light on them and think about them and face that stigma in a way, if you want things to get better.
I love the way you said that, Larry. Almost all of these things go away, and sometimes they need treatment to go away. What you don't want to do is have the thing that makes it go away leave the sport that you love. And
Hmm.
so it's hard sometimes, for suffering in silence to know when should I get help, when shouldn't I? If you've got a trainer at the side of the field and you find that, you're fine until you're sprinting fast, and then all of a sudden you've got something that doesn't feel right, it's great to be able to ask, what do you think's going on? What should I do? If you think about most mental health interventions, they're going to be really equivalent to that. They're going to listen to what you're experiencing. And a lot of the time, it's going to be something where you don't have to stop playing and you don't have to have serious treatments. You might want to just rethink a couple things. You might check back a couple times, learn a couple exercises that you didn't know before. Some things go on to be serious and need more focused treatments. But, and let's just say there are mental health trainers that would be available to listen to what are you experiencing. Should you worry about it? Might you do something different? How could you approach it? Most everything is treatable, and rarely is it going to get in the way if you get the right training help.
Mhm.
And so I think that's the optimistic part of don't suffer in silence because you'll perform better as well as feel better.
I had a reunion of our semi-pro team, and over 10 of the players that played on the team had passed away as a result of substance abuse and mental health issues, and none of us knew that was going on.
Mm.
I know that we find amongst adolescents in our services as many as 30% struggle with anxiety and depression, and they're not managing it well. And when you look at a tournament with thousands of players, I think it is a very serious concern that others may not be fully aware of. And sometimes just connecting those dots for those individuals earlier in the progression of these concerns is a way to correct, like you say, Paul, and get somewhere with that. On that note, I have a question that just kind of popped into my head that wasn't on our list anywhere. There are incidents of team initiations gone wrong. There are incidences of bullying amongst athletes that are probably more prevalent than amongst the larger population. Do you guys have any insights on that? Because I think a lot of people get dragged into a behavior that would normally not happen in a non-healthy environment. Sometimes it occurs around some athletics.
What's the phrase now? Don't be a Karen, a helicopter parent. I think from a coaching standpoint, how do you differentiate letting young athletes develop a sense of their own capacity to judge what feels right and what doesn't? You are going to have opportunities that are going to be tempting. And I would advise ahead of time you think about what are the things you want to do and are there some red lines you don't want to do? What would you do if you found yourself in a position that someone asked you to do something you weren't comfortable with or offered you something or put you in a position that was uncomfortable? Have a plan in advance about what you'd say no to and who you'd reach to for help. I think from a coaching perspective, it lets you not micromanage, but I do think it comes to the athlete, the individual, a real honest conversation of those things are real. Even with this team that means so much to you, they might have some thoughts and ideas that are contrary to your own. And are you stronger or better off by doing something you don't want to do that doesn't feel comfortable, that maybe feels bad? Or are you better off exercising your personal sense of agency in your personal life the way you would on the field and say, it's not the way I play? And I think to encourage that before the situation is always good.
I remember being asked to complete this online training every year, and coaches are given this training where they should be able to recognize signs of bullying or, worse things going on between players or players and coaches, and really taught to step up and say something. Because it is worth mentioning that those initiations, hazing, if you will, in a very mild form, people see it as, hey, this is what builds a team. This is what builds camaraderie, but it can really get out of hand and it can be really inappropriate and really destructive and needs to be stopped. And I think a lot of times that burden falls on the parents, the coaches, the adults there to say, we notice something is happening. We have to say something here. We're not going to let this go on. I've had family members who have had experiences with really high level youth teams. The culture is that you button your lip, that you don't say anything. This is a team that if you do the wrong thing, say the wrong thing, you might not be on that team the next year. The most mild case is that it affects your play on the field or on the ice or whatever with that team, but it can obviously have many worse consequences where it affects your mental health, even your physical health off the field, and it can be very detrimental if it's not stopped immediately. So it can be very traumatizing if not caught immediately.
Things happen in life, whether it's a bad outcome of a game, on that shot I missed and the team lost the championship, to someone got hurt really bad, really affected everybody. And it happens in soccer all the time and in any sport. Sometimes it's as simple as somebody can't get out of their own head after something happened on the field, maybe poor performance. And sometimes they can't get an experience out of their head, like something wasn't the way it should be. How do you help or recognize those things and how to get help for that?
Yeah, that's a great question. And there is actually a very real life example of something just like this that was in the headlines a number of years ago on the Minnesota Vikings. You may remember Teddy Bridgewater was the quarterback, and he suffered a horrendous leg injury in practice. Nobody hit him. He just was running around and stepped back, I think, for a pass, and he dislocated his knee so badly that the trainers all rushed out there. There was a worry he might lose part of his leg. I mean, it really was bad. And what people were saying about that afterwards was that it was so hard to see the injury that nobody really knew what to do. There were other players on the sidelines vomiting. It was terrible. It was a terrible experience. And the training team saved his leg. They knew what to do. They jumped into action. They got him the help he needed. They got him surgery. And as everybody knows, Teddy Bridgewater went on to play more football after that. So it was a success story in a way in terms of the injury itself. But my suggestion at the time was, hey, listen, I'm available to talk to any player or coach that was anywhere near that field on that day who wants to talk about what they saw. There are many different types of therapy for people who have experienced trauma, whether it's on the field or off. One of those types of cognitive behavioral therapy involves talking about what you saw and what it meant to you. And in some ways, it can be uncomfortable. There is some re-experiencing of those awful feelings again, but a lot of times it's the beginning of the healing process. So again, in the same vein that you don't want to take any kind of mental health issue, whether it's anxiety or stress or whatever, and bury it and ignore it and think it's going to go away if you don't say anything about it or treat it or work on it. In the same way, you don't want to just try to not think about or not talk about what you saw, again, whether it's on the field or off the field, because it's not only going to affect the way that you play that sport or that you play with that team, but it's going to affect your sleep, your appetite, your, again, depression, anxiety, all kinds of symptoms can come from this. I've had players who have seen something and they say, I've had terrible nightmares and I can't sleep anymore. I just keep seeing this event over and over again. To try to ignore it would be not only a disservice to that player, but could lead to worsening symptoms. So I'd say if there's anybody on the team, coach or clinician or anybody associated with that team who that player can reach out to and talk about it, it is very important. It is very important to try to not sweep it under the rug.
Is there anything you'd like to add for coaches who are working with young players who are up and coming?
These coaches don't really get a lot of time with their players. So it's really hard to kind of find the time to address mental health sometimes with all that you're tasked with as a coach. I've seen coaches pay some attention to mental health, and it really benefits the players and the team tremendously. We talk about this mind body connection. Never is that more clear than in sports, where if you're playing at your full mental capacity, you're going to be playing better physically. To stop and to address mental health in any way, I think really helps, and it sets the culture. So if the coaches are coming out and talking about having an atmosphere on the team of acceptance, trying to reduce the stigma of mental health, and being very open about the fact that, okay, these things are going to happen. They're a normal progression in athletics. It's something that happens to most of us. And I want everyone around you to also accept that you will be talking about this. If they don't even mention it, if the words don't come out of their mouths that this is a possibility, then a lot of times that can trigger that atmosphere of stigma on the team. So for the coach to even take 5 minutes to just talk about general mental health is great. For them to think about a few scenarios that they've seen where they can talk about those specific stories that they have about those players have played better when they've addressed it. It's invaluable for the adult to be able to look that stigma in the face, push it to the side, and say something about it and make it part of the team culture for sure.
Oh, that's fantastic. I used to coach Pee Wee boys, so we're talking 10 to 12-year-olds, and they were at a stage of rebellion, and they were really difficult personalities. And, I really enjoyed it though. And I coached 10-year-old to 12-year-old girls for quite a long time. Pure entertainment, right? My brother coached 12 to 14, and they changed
Mhm,
a lot in 2 years.
mhm,
And he found ways to have fun with them, but it was a whole different adaptation for him. So when you're coaching, kids are developing emotionally, physically, hormonally, and your 10-year-olds are different than your 12-year-olds, are different than your 14, 16, and 18-year-olds. And you're facing a rapidly changing individual who is fighting their own battles with their self-identity as they move through these stages of life. And a lot of times a coach will travel with that player. So can you share some insights about that experience from a coach's point of view? How best to navigate that change, right? How to be aware of it and how to be receptive to these kids evolving their personalities.
The coaches that I've seen be most successful are coaches who understand that developmental trajectory and they understand what the kids at that particular age group, at that particular stage, are capable of. And so they know how to ride that fine line between this is a kid who needs some support, this is a kid who's kind of at the kind of average baseline, I guess you could say. And here's a kid that I think has a little bit more capability, and I can maybe push them to be a better player or a better teammate and a better citizen as well, but push them to do a little more. Coaches a lot of times know that instinctively because a lot of times those coaches are parents who have their own kids on the team and they see what their own child is capable of and they have a gut feeling for that developmental trajectory. I think coaches a lot of times run into trouble when they push too hard. They're not really necessarily sure of what this age group or one particular kid is capable of. So they push a little too hard. They're looking for NFL athletes on a team of 12-year-olds or something like that. And to their credit, trying to get kids to kind of step up, take the sport seriously, work harder. A lot of times that is where the improvement comes, and that's their job as coaches. But if you push a little too hard and you're pushing in a very unrealistic way, a lot of times it leads to pain and struggle, and the team ends up not doing better. They end up doing worse. A lot of times in professional sports teams, that's when you see coaches or other staff members get cleared out and fired, and you get a whole new round of coaches put in their place to try to develop a new culture and to try to find a different way of doing things. And so coaches often struggle with that. What's the way? What's the manner that I use to get this job done? There's also biological processes that deserve some attention. There's this neurological process called synaptic pruning, where as infants and toddlers, as our brains are growing exponentially, the number of neurons in the brain, brain cells that are created is just it's exponential. Every day, more neurons are created, and more of these neurons start to communicate with other neurons. And when one neuron communicates with another, we call that a synapse, the connection where they talk to each other basically through a series of chemical interactions. We call that connection a synapse. And what happens is in toddlers, in latency age kids, though there are so many of those synapses that are created, and it's a little bit overkill. And it turns out we don't really need all of those synapses. So in adolescence, there's a really, really somewhat difficult process that happens called synaptic pruning, where a lot of those connections are actually severed and destroyed because the brain is basically saying, we got too many connections here. We don't need all of this. Let's get rid of some. But as you can imagine, that process is not always very fluid or it's not perfect. That sometimes the pruning of these synapses can lead to some trouble. There was a great book called Brainstorm about how the adolescent brain changes so rapidly that it can lead to all these changes, which are really sometimes hard to accept, sometimes hard to navigate as a 13, 14, 15-year old. You're happy and laughing with your teammates one minute, you're crying the next minute, and then you're screaming at your parents and punching the wall the next minute. It can be really, really dramatic. And that's part of what's happening in that neurological process that's happening in adolescence. A lot of things are changing, and it's really important for people to know that that's coming. And it's really important for the parents and the coaches of kids and those adolescent people should be aware of it. People should feel comfortable addressing it, and to some extent normalizing it and say, hey, this is part of the landscape here, and we have to accept that this is what's happening. We're not going to ignore it, and we're not going to let this problem balloon into this bigger problem. But we do want to pay attention to it and say, hey, this is normal. How do we deal with it? What do we do with it? Definitely thinking about some of the processes that are involved, some of those changes that happen at those levels can really help you understand as a coach what's the difference between how I coach a 10-year-old and how I coach a 15-year-old. And like I said, a lot of times it's instinctual, but sometimes it's important to know what's actually going on behind the scenes.
It's actually a more fascinating answer than I expected. That was awesome. I like that very much. Thank you. And we'll do more if you're available. I would love to. It's really great to meet you, like I said, and spend the
Super
time.
helpful. Yeah. Oh, I love it. This is great. Yeah.
Yeah.
Thanks for thinking of me. Thanks for inviting me. I appreciate the opportunity. I'm going to be texting my sister in a minute, asking her about this. This is great. Very good. Well, good luck, and I hope I see you around soon.
Yeah. Thanks, Larry.
All right. Thanks. Have a good day.